Hey there, welcome. So let's talk about a word we throw around all the time, medicine. We all think we know what it means, right? But what if I told you there's a whole other side to it? A side most of us completely overlook.
All right, so to really get to the heart of what medicine is, maybe we should start with what we think it is. You know, that default definition we all have tucked away in the back of our minds.
No, really, think about it for a second. When I say the word medicine, what's the first image that pops into your head? Who do you see? Where are they?
I'm willing to bet you're thinking of things like doctors and white coats, sterile hospital rooms, maybe a prescription bottle, or even the thought of surgery. And yeah, you're not wrong. For most of us, that's exactly what medicine is. It's the fix. It's what happens after something's gone wrong.
But of course, that's where things get interesting and a little more complicated. See, the word medicine isn't just a standalone thing. It's actually tangled up in this huge web of related ideas, which is exactly why pinning down a single clear definition is so important.
I mean, just think about the whole world of healthcare, right? You've got all these different disciplines, all working to keep us healthy. And while they might seem separate on the surface, their goals and even their methods start to overlap and blur together. It can get pretty hard to tell where one field stops and the next one starts.
You've probably heard some of these terms, right? Things like community medicine or public health. That's the big picture stuff, looking at entire populations. Or preventative medicine, which is all about getting ahead of sickness before it even happens. They're all part of the same family, but yeah, those blurry lines can make things pretty confusing. So the big question is, how do we cut through all that confusion? Is there one definition that can tie all of this together? Well, it turns out there is. Thankfully, a guy named Henry Sigerist, a medical historian, came up with a really elegant and powerful way to look at it all.
Just listen to this. It's so simple, but it covers everything. Sigerist said the mission of medicine is four things: to promote health, to prevent illness, to restore health, and to rehabilitate the individual. Boom! See? It's not just about fixing you when you're broken. It's so much more.
And this is the real key. Because hidden inside that simple four-part mission are the two different faces of medicine, two sides of the same coin.
Let's break it down. If you look at those four parts again, you can basically draw a line right down the middle. The first two, promoting health and preventing illness, that's all the stuff that happens before we get sick. But the last two, restoring health and rehabilitating, well, that's what happens after.
And there it is. That's the big idea. It's not four separate things. It's really just two core components that make up the whole picture.
So let's put them side by side. On one side, you've got the promotive and preventative stuff. This is the proactive side of the street. It's all about keeping people from getting sick in the first place. Think vaccinations, health education, that kind of thing. Then on the other side, you've got the restorative and rehabilitative. This is the reactive side. It's the treatment and recovery after you're already sick or injured. And honestly, this is the side that most of us think of when we hear the word medicine.
Okay, so, cool definition, right? But why does any of this actually matter? Well, because this isn't just some academic thought exercise. This split, this duality, has huge real-world consequences for every single one of us.
I mean, this idea of proactive versus reactive, it shapes everything. It's the difference between the personal choices you make every day, like going for a run to stay healthy versus needing medication for high blood pressure. And when you zoom out, it literally dictates how our entire healthcare system is built, what gets money, what gets researched, and what gets prioritized.
And that really brings us to the big final question, doesn't it? Our healthcare system, as it stands, is massively tilted to one side, the reactive, fix-it-when-it's-broken side. That's where the money and attention go. So what would actually change if we found a true balance? What would our world look like if we put just as much effort into promoting health and preventing illness as we do into treating it? Something to think about. Thanks for tuning in.